Thank you for joining us. Our conference will begin momentarily. Hello?
Hello?
Thank you for joining us. Our conference will begin momentarily. reminder to maintain quality audio, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. WisconsinEye is streaming the audio for today's briefing, and DHS will have a video of the briefing that will be sent to you this afternoon. Joining us for today's briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, Dr. Ryan Westergaard, Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nelson-Stoon, Chief Legal Counsel for Governor Evers. He's available for answering questions. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us. A lot has happened over the weekend to respond to COVID-19, including a call for closing public schools, limiting access to nursing homes and assisted living facilities, and making it easier to transport necessary products to the people who need them. I'm proud but not surprised by the efforts of the people of Wisconsin to rise to the challenge to keep ourselves, our families, and our communities safe. So I want to offer my thanks, first of all, to the school superintendents and school boards across the state. We've been planning for the possibility of school closures, and when the directive came, worked throughout the weekend to inform parents and guardians about the closures, made sure kids who rely on school lunches will be fed, and who continue to plan to educate our children under circumstances none of us could have predicted when the school year began last fall. To the kids, we know that school is more than books and quizzes. This response means many of you are missing out on sports tournaments and other things you've worked on all year to reach. Dance competitions, art shows, band concerts, all have been postponed or canceled, as are many trips that you look forward to. We know it stings, but we're sorry, very sorry that it had to happen. There's a lesson here that you wouldn't necessarily get in the classroom, and that is life is unpredictable. Please understand that your health and safety is our top priority, and we're grateful for your flexibility and understanding of your parents and your teachers and your coaches. Thanks as well to the families who have loved ones in the nursing home and assisted living centers. We know it is hard being unable to visit, but it's truly in the best interest to protect the health of Wisconsin residents who could be especially vulnerable to COVID-19. And earlier today, we announced our next actions to keep the public safe. Folks, it's on all of us to practice social distancing and take every step possible to mitigate the spread of COVID-19. That's why I directed Secretary Palm to order a ban on mass gatherings of 50 or more people effective at midnight tonight. Critical infrastructure and services such as grocery stores and food pantries and child care centers, pharmacies and hospitals will be exempt from this order. This isn't a decision that I made lightly, and we understand it will have an impact on Wisconsin workers, families, businesses, and communities, but keeping folks safe and healthy has to be our highest priority. This order includes gatherings at theaters, arenas, conference rooms, and auditoriums. It does, however, allow restaurants, bars, and other businesses to remain open so long as they follow guidelines on social distancing and have fewer than 50 people or operate at less than 50% capacity, whichever is less. The Department of Health Services is staffed by experts who work with the Centers for Disease Control, local and tribal health officers and partners in healthcare to help us all stay up on the rapidly changing situation. Please use their web pages, social media accounts, and other communications for factual and timely information about COVID-19. Before I turn things over to Secretary Palm, I'd like to add that this situation requires more than just an all-government response. This situation requires the support of all in Wisconsin. Some folks can help best by going into work and supporting critical health care and public safety efforts, as well as supporting key community services. Some folks can help best by volunteering, donating blood if they can, and donating items such as non-perishable food, diapers, wipes, formulas, and paper products through local nonprofits. And some folks can help best by listening to DHS and CDC guidance on social distancing and staying at home. Everyone can play a part here in Wisconsin in keeping us safe and healthy. So thank you, everybody. And now I'll turn this over to DHS Secretary-Designee Andrea Palm.
Thank you, Governor. As you know, the number of cases grew significantly over the weekend, and here's where we stand right now. We've had 504 negative tests and 46 positive tests, and our one confirmed case who has recovered. This growth is not unexpected as more people are tested, but through the combined efforts of your federal, state, and local governments, we can and must slow the spread of COVID-19. As the governor mentioned, schools around the state have closed in an effort to stop the spread, and today we have announced that as of midnight tonight, all public and private mass gatherings of 50 people or more are prohibited in the state. The governor outlined some of those specifics, so I won't repeat them. These measures are part of our ongoing efforts to mitigate spread. I want to echo Governor Evers in offering our thanks to the local and tribal health officers, our partners in the healthcare system. They are working tirelessly toward our goal of reducing the impact of this disease on the state of Wisconsin. In my year with DHS, I've been constantly amazed by the strength, resiliency, and sense of community of the people of Wisconsin. We will get through this together. As this health situation evolves, Governor Evers and the Department of Health Services, with the help of our many valued partners, will continue to provide timely guidance and information that you need to help reduce the spread of the disease and protect our communities. Over the weekend, we worked to put out guidance for daycare facilities, which we are recommending stay open at this time. In the coming days and weeks, there are going to be more disruptions in your lives. We are going to continue to ask you to do more social distancing. I know this is difficult, but this is how we are going to prevent more people from becoming exposed and infected with COVID-19. Right now, we are working with local health departments who are focused on contact tracing of our new confirmed cases. This is critical work, and it will help keep our communities safe. When a case is confirmed, we interview that person about every interaction that they have had, every location they have gone to, and anyone who may have been exposed to COVID-19. We then work to notify any of those that are exposed so we can take additional actions with those individuals. It's important to remember that the people most adversely affected have been the elderly and people with underlying health conditions. It is our responsibility to practice social distancing to help protect these vulnerable populations. In addition, please know the signs and symptoms of COVID-19: fever, cough, shortness of breath, and what you need to do if you become symptomatic. Please stay home if you are sick. Call your healthcare provider's office in advance of a visit. Limit your movement in the community and limit who comes to visit you. Also know what additional measures you should take if you are at higher risk for severe disease. Please continue to focus on the personal protective measures we've been talking about, like your respiratory etiquette, hand washing, and cleaning surfaces frequently. Create a household plan of action in case of illness and as there is further disruption in the daily activities here in the state of Wisconsin due to this outbreak, including a 2-week supply of food for your family and pets, needed prescription medicines, and please understand what plans your employer has for telework and other social distancing strategies. Know about ongoing emergency operations plans for your school and for the places that you work. Thank you, and I'd like to now turn it over to Dr. Westergaard.
Thank you, and good afternoon. The COVID-19 epidemic is entering a new phase this week. So we're detecting more cases of the disease in Wisconsin residents who have not traveled out of state. This means the virus is spreading in Wisconsin communities. As the Secretary said, we at DHS are continuing to investigate every single case of COVID-19, identifying and monitoring people who may have been exposed to the virus. At the same time, though, we need to implement measures that involve cooperation of the whole community to prevent the possibility of the virus spreading between people who may be infected but not know it. It's now well understood that people can be infected with the virus that causes COVID-19 and show mild or even no symptoms. In fact, the majority of people who become infected with the virus can be expected to have symptoms that are not severe. So it's critically important that everyone understands what we mean and why we mean and supports this whole community approach, as the governor said, to the epidemic. Keeping the number of illnesses and deaths from COVID-19 as small as it can possibly be is going to require a committed, team-based approach. The healthcare team, the nurses and doctors and other staff in hospitals, are remarkably well prepared to treat patients with COVID-19. Even patients with severe critical illness who need ICU-level care can be expected to recover with the supportive care that's delivered in our hospitals. But we have a finite number of ICU beds and ventilators. In a pandemic situation, the real risk is that the number of critically ill patients will grow too large too quickly, and we may not have enough resources to save everyone who needs critical care. In this situation, which we want to prevent at all costs, is what requires the whole community approach to the pandemic. When we ask people to stay home to avoid social gatherings, the reason is specifically to support these frontline healthcare workers. We work together to keep the overall size of the epidemic as small as we possibly can. We can use our hospital resources to support everyone who needs them. The last topic I'd like to provide an update on is the status of COVID-19 testing. The capacity has increased in our state. The state public health lab is now able to test 7 days per week, as many as 400 specimens per day. Large commercial labs that are out of state as reference labs and some hospital labs in Wisconsin are testing right on site, which means that patients can get the test results back more quickly. We expect that to continue. New technologies are coming online, hopefully in the coming months, that will dramatically improve the capacity for testing in Wisconsin. So eventually, testing for COVID-19 will become as rapid and as commonplace as testing for influenza. But at the present moment, there's not enough capacity to test every person or even every person with respiratory symptoms. So we have specific recommendations. The first is that there's no need to test people who are not having symptoms. Testing is for making a diagnosis in people who are sick. Second is that people with mild symptoms like the common cold, the kind of symptoms that you may not seek medical attention for, also generally don't require testing. We may recommend testing people with cold-like symptoms in certain circumstances, like as part of a public health investigation or if they're healthcare workers. But for most people who have a cold right now in this situation, our recommendation is to self-isolate. That means to stay home and out of close contact with others as best you can. Testing at this time is encouraged for anyone who has an influenza-like illness, which typically means having a fever or lower respiratory symptoms like cough and shortness of breath. And we must prioritize testing for people who are hospitalized, where the information about who has COVID-19 is required quickly.
Thank you. We will now open it up for your questions in order of your RSVPs. And a reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. We'll begin with Tony Aria from TMJ4. Tony? Tony from TMJ4. And we'll move on then to Megan Silver from WUWM, Milwaukee Public Radio. Milwaukee Public Radio. And remember, *6 to mute and unmute your phones, please. And we'll move on to Mark Leland from WLUK. Mark?
Hi, sorry, this is Mayan. Can you hear me?
Yes, we can now.
Okay, great. Super quick question. Are you going to require state employees, this is for Governor Evers, to work from home?
We're leaving that up to the individual leaders in each of those agencies. If it's possible that they can work from home, yes. If their work is needed to be on site, the answer would be no. And so each agency has the ability to figure that out. And frankly, we having run an agency for 13 years, each agency has this plan in place, and there should be really no surprises. This plan's been in place for a long, long time, and so we're not saying everybody should work at home. We're going to make those decisions at the individual agencies.
This is TMJ4 News. We're unmuted here, just so you know.
Okay, but we'll go back to you then, to TMJ4.
I have a question for Dr. Westgard. What are the conditions of the 46 patients? I also have a question for the DHS secretary. How fast are we getting these test results back? Because with the MPS, just this weekend, that MPS worker, Milwaukee Public Schools, it was a presumptive positive and needed further testing. It's getting very difficult for us to keep track of these numbers. For the governor, what is your message for the small businesses that may have to shut down during this time? And for legal counsel, what if people don't listen to this ban?
This is Ryan Westergaard. I can take the first question that came about the condition of the individuals. So there's now a larger number, so there's a wide range of individuals ranging from minimal to no symptoms. In the majority of cases are recovering in the home setting. We do have several patients who are hospitalized and some who are critically ill. We are staying in contact with healthcare providers for our status updates, but we don't have a way to summarize individual cases by location.
How many are critically ill, and how old are they?
We don't have those details available right now, but we can follow up.
And the DHS secretary, how fast are we getting back these results? I know that Madison and Milwaukee, those were the locations where you were doing the tests, and also I heard that you guys don't have enough tests and you're not able to test everybody at this time, and that's why you want people with really big, symptoms, not for the worry well, to come in. What is going on? Why don't we have enough to test everybody right now?
It's a really important question because I think contextually people need to understand that testing shortages are a nationwide problem. The deployment of these tests, as everyone knows, was delayed, and as state labs like our state lab and others have come online, they are ramping their capacity as much as they can, as quickly as they can, but access to test kits as well as some of the supply chain issues more broadly, the reagents and other some of those other supplies that you need in your lab to run these tests have come in and out of supply challenges throughout this outbreak, as other parts of the world and other parts of the country have stressed the demand or stressed the supply of different pieces of this testing process. So currently at the state lab, our tests are being turned around in 1 to 2 days, and we anticipate as their ability to scale and to do more tests per day grows, that time frame could increase. But we are currently running on a 1 to 2 day turnaround at the state lab. Other labs, private labs, and clinical labs in hospitals have different kinds of platforms that are running these tests. Some of them are higher throughput. Some of them rely on different kinds of technologies. And so their turnaround times can and are expected to be different than ours. It really will depend on the technology and the throughput of the specific platforms that they are using. But we are very anxious for additional hospitals around the state of Wisconsin and other private labs to come online to support the increased capacity that we need here in the state of Wisconsin and that all other states need around the country.
And the legal counsel, if people don't listen to this ban or if there's more hoarding, what is your message if people aren't listening and they stay open and there's still 50 or more people who are gathering and think that this is no big deal?
Sure. Well, first of all, state law does provide for punishments if people do not comply with the order, both in terms of fines and imprisonment. But that said, people are cooperating. We've seen people act proactively on their own throughout the state. And this order from the governor today will be able to provide consistency across the state, and we expect Wisconsinites will do what they always do, and that's to chip in and do their part.
What would the imprisonment be? What would be the charge?
We'll follow up with you on that.
And then to the governor, what should small businesses? What's your message to small businesses who may be really hurt by this?
Well, and first of all, I have to say, yes, small businesses may be hurt by this, but everybody's taking it on the chin here. Whether it's our kids in schools, whether it's our small businesses, large businesses, restaurants, you name it. And so what we're doing right now is making sure that the virus is not spread as quickly as it could, and to minimize and mitigate those things happening. We are, each of our agencies, railing from the Department of Workforce Development, dealing with workers who are going to be struggling, to WEDC, our Economic Development Corporation, to other state agencies. We're all preparing for that end day when we are not worried about mitigation, that we're worried about making people whole in the future. We're all working towards that. We may need to have legislation to make that happen, but we are working on that. And I appreciate your question about small businesses, but there's all sorts of folks that are going to be taking it on the chin moving forward. We have to stop this virus from spreading. That is our point right now.
Okay, and thank you, TMJ, for it. In the interest of time, because so many of you have questions, we're going to limit it to one question and one follow-up. So we'll continue with Mark Whelan from WLUK in Green Bay. Mark?
Hi, my question is, one for the governor, just to clarify on the ban of gathering of people. Are casinos involved in this, and what about airports? And for Secretary Palm, about the new cases, it's my understanding, so you're saying we've added 13 cases since yesterday. Where are those new cases, and do we know how they were transmitted?
So I'm going to pass the first question on to Ryan.
So airports are exempted from the ban. In terms of casinos, we're working with our partners, with the tribal nations. We're working lockstep within them to make sure that the same policies and guidance that we're putting out today, that the tribal nations are also ensuring it. Again, we're all in this together to make sure that the public health is protected, and that includes the casinos.
As to the question, this is Andrea Palm. As to the question of counties, we are now Dane, Fond du Lac, Milwaukee, Outagamie, Pierce, Racine, Sheboygan, Waukesha, Winnebago, and Wood counties. And as we have done every day, we will provide this information on our website.
Thank you, WLUK. To Juliette Alperin from the Washington Post. Juliette? A reminder, star 6 to mute and unmute your phone. Washington Post. And we'll move on to David Wahlberg from the Wisconsin State Journal. David?
Yeah, hi, thank you. Dr. Westergaard, I believe you said that there definitely is community spread now of COVID-19. Can you just characterize that a little bit more? Do you believe it throughout the state, just certain parts of the state, and how long do you believe that's been going on? And then the follow-up is, does that ultimately make the contract tracing unnecessary?
Those are very good questions. Thank you. The reason we conclude that there's likely community spread in Wisconsin is based on a number of factors. Every case, as we mentioned at this point, that we identify still undergoes an interview about travel history and contact with others. So the data for these new cases is not complete, but preliminarily I heard about cases being reported in people that don't have a travel history or exposure to a previous known case. So that is sufficient for us to say that they're not travel associated and likely reflect person-to-person spread inside Wisconsin. Now the question of how widespread is community transmission in Wisconsin, we don't know because we've sampled a relatively small number of individuals with symptoms. Given that the pace of new case detection around the country is just starting to take off, my expectation is that it is not in all Wisconsin communities, but the risk is that if the trajectory continues, that it could be in the future. That's really the motivation for the social distancing measures, is to prevent it from spreading outside of communities and to minimizing the spread inside communities.
is Scott Bauer from the Associated Press.
Hi, thanks for the question. Governor, two-part question. You had mentioned maybe requiring some legislation. Are you envisioning possibly calling the legislature back into session to take up anything? And would that include, or is there any consideration of postponing the April 6th presidential primary?
Two questions. The first one is around a possible legislative activity, and we're still working on that and looking at what exactly we would be asking for if we did that, and we'll be working with the legislative leaders going forward on that. The second question is about the election, and we are encouraging people all across the state to avail themselves of absentee balloting or early voting. Either one of those work. If you want an absentee ballot, I believe you can still go online to get that and have that sent to you. We are evaluating, watching this as it goes forward, and we're hopeful to hold it on the date if we possibly can. But one of the ways to make sure that people's votes are counted is to vote early or absentee ballot.
So is moving it on the table, is that being discussed?
Not at this time. What we're trying to do is make sure that people in Wisconsin are safe. If there's ways that we need to make that happen on the day of an election, we'll be looking at that. But at this time, we're trying to get as many people to vote early and or vote absentee.
Thank you, Scott. Moving on to Andy from WISN in Milwaukee. Andy?
Hi, this is Kent Wainscott from WISN. Just two quick questions. Was the governor on the call with the president this morning? And if so, can you tell us a little bit about that and what was discussed?
Yes, I was, and lots of things were discussed. The people from CDC talked. Actually, the president talked for some period of time also. The questions were interesting, and it varied by, they were very localized questions, such as lots of questions around testing protocols, lots of questions around, frankly, how to get ventilators and respirators, and the request of the federal government, and I'm sure our folks have heard this request from the federal government also, was that going through local suppliers of that is going to be as quick or quicker than waiting for the federal government. And so a lot of questions around just kind of basic issues. So it was good, robust conversation, not a lot of shouting and screaming, but everybody working together, federal government, state government, to make sure that the people of this country are safe.
Thank you.
And just if I can just ask one more quick question about, you talked about relying on stores to have a 2-week stockpile of food and things like that, with people not going to restaurants perhaps, and maybe relying more on grocery stores than in the past. We talked to some stores who said they're having some issues with supply already. Is the state doing anything, or can you do anything to open up supply lines or to ensure that these stores stay stocked?
Sure, absolutely. I know Ryan has answered one of the answers to that.
So one of the steps that the state has already taken, you may have seen over the weekend, the governor directed the Department of Transportation to lift certain restrictions on truck weight limits. That was at the request of grocers across the state so that they can restock their shelves quickly. The order, just to clarify, does not close down restaurants, so those still will be available. What it does do is put limits on restrictions, on capacity restrictions, and also requires social distancing measures to be taken place. So those options will still be available for folks.
And our Department of Agriculture, Trade, and Consumer Protection are working directly with suppliers of food, and we believe that at this point in time that the supply chain of food in the state is still strong.
Thank you, Ken.
Thank you.
Excuse me, one other thing, and the President talked about this a lot yesterday and talked about this today. So I just want to pass this on from the President of the United States, and that is people shouldn't be hoarding. I know he talked about that last night, and he talked about it again today. So I'll answer two questions at once there.
Thank you. To Sean Kirkby from Wisconsin Health News. Sean? And a reminder, star 6 to mute and unmute your phone. Sean Kirkby. We're going to move on then to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Thanks for the time here. Governor, I'm wondering, can you tell me why you chose 50 at the level rather than an outright ban at bars and restaurants? I'm wondering if that will do enough, and wondering if you would go, would you still consider a total ban at a later point?
I can answer that in one short way, but I'd like to have the folks at Health Services also to answer that. That's the CDC recommendation was around 50, was using at 50, and their recommendation, we decided to make it a mandate. And so we're following the science at the CDC and also obviously the science at the science agreement at the Department of Health Services.
Thanks. And can you tell me what agency is going to enforce this? Who's going to make sure that this is nobody's violating this?
So Patrick, this is enforced primarily by local officials.
Got it.
Thank you, Patrick. Moving on to Shemaine Mills from Wisconsin Public Radio. Shemaine? Shemaine Mills, Wisconsin Public Radio. And a reminder, star 6 to mute and unmute your phones. We're going to move on to Cooper Henkel from WJFW in Rhinelander. Cooper? Okay, moving on then to Mitch Smith from the New York Times. Mitch? Okay, to Austin Montgomery from the Beloit Daily News. Austin? And a reminder, star 6 to mute and unmute your phone to ask your questions. We'll move on then to Sandra Tornbergson from Spectrum News 1. Sandra?
Good afternoon. This is Ryan Burke from Spectrum News. Getting back to the restaurant ban, are there any indications, or what would it take for a all-out ban to be considered for dining in, as we have seen take place in other states, as opposed to capping it at that 50 number?
So I think the consideration here, this is Andrea Palm with the Department of Health Services. The consideration here was that in the context of restaurants, social distancing, which is the strategy by which we really are preventing the spread of COVID-19, is possible in a restaurant. And so long as, and you can see the specifics in the guidance, so long as customers are 6 feet apart, so long as we are reducing to 50 the number of total people or half of the capacity of the restaurant, we can employ these social distancing strategies so that at this point we did not think it was necessary to do an outright ban. I think what you have seen in other states is that concern about people pitching in and doing their part as it relates to taking this recommendation. So I think we will be wanting to see how it goes here, but obviously we'll do what is necessary to protect the health and safety of the people of this state. But we are hopeful that this is a middle ground, a good first step to really be clear about what we need to be doing as it relates to social distancing, but allowing some of these establishments, which are small businesses all around this state, not to have to shut down if it is not necessary. If we can, as a community, as a state, do the necessary things to really be strict with ourselves about social distancing.
Thank you.
Thank you. Moving on to Katie from NBC 15 in Madison. Katie? NBC 15? And a reminder, star 6 to mute and unmute your phone. Moving on then to Mike Kemeter from WHBY Radio in Appleton. Mike?
I'll pass. Thank you.
Thank you. Moving on to Isaiah Holmes from the Wisconsin Examiner. Isaiah?
Hi. One for the governor. I was wondering if we could get an update on the National Guard situation in the state, like how many have been deployed and, you know, what their role will be going forward, since things are moving forward so quickly. And then one for DHS. I was just curious, are there different strains of the virus that causes COVID-19, and do the test kits account for different strains, or no?
I'll start out with the National Guard question. Thanks for asking. Adjutant General Knapp and the men and women of the National Guard have been doing great work. Not only are they organizing statewide to be helpful, but as you know, we worked with them directly in bringing home 28, 29 people from Georgia yesterday, and it was a lot of work, believe me, just to make that happen. These people were on one of the cruises that was sitting out in the Pacific Ocean for several days. People, they were Wisconsinites, and the Guard was able to get them to Boat Field last night and get them home by early this morning, and so we really appreciate the help of the people and the airmen and women and the soldiers who took these people home are now putting themselves in quarantine for 14 days to make sure that they're fine. But the National Guard's been very, very helpful in our efforts in planning and organizing and communicating to the people of Wisconsin. They've done a great job, and I thank the new Adjutant General for that.
This is Ryan Westergaard. I can take the question about the virus and the specificity of the testing. At this time, it's only known to be one strain of the virus that causes COVID-19, and the test that's in use specifically tests for that one known virus. Research labs are able to do surveillance for other novel respiratory viruses. That work is ongoing, and so far there's no indication that there are other viruses circulating.
Okay.
Thank you.
To Jessica Van Egren from Up North News. Jessica?
Hi, thanks for taking my question today. To the point of community spread now being in sections of Wisconsin, and to another point, I guess, of us, you know, only having a limited capacity of ICU beds and ventilators. Who has a handle on what those numbers are right now in Wisconsin? Like statewide, do we know how many ICU beds we have, how many ventilators we have, or how many more ventilators we would like to purchase? Given that it sounds like there's a shortage, is that something we're actively going after right now?
So the healthcare system, our hospitals across the state, sort of like the planning that the governor mentioned earlier as it relates to the state workforce and others, have been doing planning and exercising around pandemics and outbreaks. And so that piece of this sits with them. They know which wings, units, facilities they can convert to expand their capacity. They know how they will work together to share resources in more localized places where that is necessary. But we are working in partnership with them as they continue to assess those needs and those shortcomings or gaps, so that we can be good partners to them in doing everything we can to secure additional resources as are necessary.
Thank you, Jessica. Brianna Riley from the Times Mag.
Hi, yes, can you hear me?
Yes, we can.
Great, thanks so much for taking my question. I'm curious about what resources are in place to help hourly workers who are losing wages. Is the recommendation to seek unemployment at this point, or are there other things that they should be looking at?
We're looking at all options, frankly. That relates similar to the question about small businesses that I received earlier. As I said, everybody is going to be impacted by this, and each agency that is involved with either the worker end of it, such as the Department of Workforce Development, or the business end of it, various agencies have direct contact with businesses across the state. They're now essentially categorizing that and seeing what help is going to be needed. Obviously, the federal government, we're hopeful that what was passed in the House of Representatives is going to be passed by the Senate in the near future. And it seems to be, frankly, not faltering, but I would encourage people to call your senators and get them behind this. Part of the answer will be federal government, but we have to be prepared in Wisconsin in case they fail to do their duties, but I think they will at the end of the day.
Thank you, Brianna. To Danny Maxwell at WKOW in Madison. Danny?
Hi, thank you. I was wondering if the governor could speak about the State Emergency Ops Center kind of elevating its response today to a level 1. I believe that's the highest level and the first time this has been done for a health emergency like this. What is being done at that Ops Center as far as coordination with agencies?
I'm going to turn that one to Ryan.
Hi, this is Ryan Elsistoid. So the reason why the governor directed SCOC to be at level 1 was that it allows one place for all the agencies to coordinate the response. And so we have all the key agencies have representatives there. We have the governor's office. We have the adjutant general and the guard, and the good folks at Wisconsin Emergency Management there as well, so that we can quickly respond to this situation as it develops. Importantly, we have Department of Health Services there as well to be able to provide the science so that we can make informed decisions. But the goal of having it at level 1 is that we can quickly respond to this situation, find resources when we need to find resources, and then also plan, for the next week, 2 weeks, 3 weeks in terms of what we need to combat COVID-19.
I had a follow-up question. You kind of talked about the status of testing early on in the news conference. I was wondering if Wisconsin is considering, like other states have done, setting up drive-through testing sites or anything like that.
So we're exploring all options. I think one of the pieces of news that came out yesterday was from the federal government and their interest through a partnership with private companies to facilitate the expansion of lab capacity with some additional resources. We are anxious, certainly, to learn more about that, but we continue to look at options for centralized collection of specimens, as well as other opportunities to expand our capacity to test and to run results in our labs.
All right, thank you.
Thank you, Danny. To Alex Moe from Which Business. Alex? A reminder, star 6 to unmute your phone. Alex Moe? Are you there, Alex? Okay, we're going to move on then to Gwen Gunther from Wheeler Reports. Gwen?
I'm going to pass at this time. Thank you.
Thank you. Laurel White from Wisconsin Public Radio. Laurel? Okay. CNN. Artemis from CNN. Okay, moving on to Matt Piper from USA Today Network. Matt? Reminder, star 6 to mute.
Yeah.
Are you there, Matt?
I am, yeah, thank you. So you mentioned the different components of these test kits, and I think there are the collection kits with the swabs and the liquid. There's reagents. I guess there are
RNA extractors, there's some need for the virus itself. I am far from an expert, but could you take me through one by one your level of need for each of these components as best you can tell?
So maybe I'll let the scientists talk about that one.
I would say I think it's safest from clearest to divide it into kind of two categories. There's the patient-facing side or the health system side and the laboratory side. And I think that the overall question is that any piece in this chain is subject to limitations on the supply, and they vary health system to health system. So it's difficult to get an accounting of the overall supply of everything. And we don't have, at this time, a clear signal that we have a shortage of any specific reagent in this test. But to walk through the process, very similar to the way tests are collected for other respiratory infections like influenza, the patients have an encounter with a healthcare provider who, as part of a physical exam, will collect a specimen, typically a nasopharyngeal swab, so it's a Q-tip in the nose and the throat. And that gets put into a viral transport medium, which then gets submitted either to a local lab that's connected to the hospital and then transported to a reference lab. Eventually, we're hoping that these labs can be done at the point of care, similar to the rapid influenza test. But at this time, because there's a small number of tests or laboratories doing the test, they all have to get shipped via a courier to a reference lab, such as the State Lab of Hygiene or one of the other cooperating labs. Now, the procedures in the lab don't require virus that was needed for development of the test, but they do need a number of reagents and equipment that identify the sequence of the genetic material in the sample and to detect positive or negative whether the sample is the piece of viral nucleic acid is detected in the specimen. So our colleagues at the state lab have put a good number of information about the processes and standard operating procedures on their website. But those are the main pieces. And I think that the overall sense is that we need to be vigilant about the various parts, the various reagents that could be in shortage. But at this time, we don't know that they are, and we're working at a capacity of about 400 a day at the state lab, and other labs are coming online. So we are optimistic that the testing capability is getting larger as time goes on.
Thank you, Matt. Moving on to Jeremy from urban Milwaukee. Jeremy?
Question for Ryan. What is the state's total testing capacity beyond just the public testing?
We would say at this time the majority of tests being done in the state are at the state lab, and as I said, their capacity is about 400 per day. If we approximately doubled that with adding all the other tests together, it might be in the ballpark. But it's such a dynamic situation because individual labs we hear about on a week-to-week basis are coming online, and their capacity is determined not only by equipment and reagents but also by staff. So it's difficult to get a precise number, but I would say that the ballpark would be between 400 to 600 tests per day in the state, and that's subject to change.
Thank you.
Thank you, Jeremy. To Bruce Marcus from WRJO. Bruce? Hello, Bruce? Okay, we'll move on to Ashley McCallum from the Gazette in Janesville. Ashley?
Hello. Hi, my question is in regards to testing and that mention of potentially being able to test on-site at medical facilities. Are there any facilities across the state yet that can test on-site? If so, where are they? And is there any idea how soon we could get testing widespread at hospitals across the state?
So individual hospitals that have capacity for high or complex laboratory testing have been needed to develop their own methodologies for doing this. And we've been told that there are 2 labs in Milwaukee at the Children's Hospital and the Wisconsin Diagnostic Lab associated with Freighter that have come online, are able to do this internally. Other health systems are in various stages of the process. Now, the type of test that can be done at any lab, sort of the simple kits that any lab can buy, or in the point-of-care tests are not yet approved by the FDA. They're not available for purchase. So that's going to take some time, but we're optimistic that because of the public health emergency, those processes are being expedited. So within the coming months, those things will be available, but it really depends on the whole system and how these things can be manufactured and submitted for approval.
Thank you, Ashley.
All right, thank you.
Sarah Seifert from the Eau Claire Leader Telegram. Sarah? Eau Claire Leader Telegram. Okay, moving on then to J.R. Ross from West Politics. J.R.
Hi, it's J.R. Thanks for the time. I have two questions. First, Governor, obviously you took the difficult step of ordering schools closed, but why not daycare centers? I mean, there are sometimes dozens of kids at those centers. Why are they different from a school? And two, if I heard correctly earlier, you talked about how there's a 1 to 2 day lag in state labs. Do you have any idea how many tests are waiting to be tested, analyzed on any daily basis? Is there any kind of backlog at the state lab for these tests?
The child care question is a really important one, and thanks for asking that. Obviously, when you have public schools across the state being closed, obviously when you have thousands upon thousands of Wisconsinites who depend on child care in order to work, means that there needs to be effort on our part to do everything we can to keep the child care industry, for lack of a better term, operational. And so our Department of Children and Families is working very hard to allow that to happen. We believe we'll be successful, and it's our goal to keep those child care centers to be continue to operate. Without them, it would be extraordinarily difficult for us to maintain any kind of equilibrium in the state of Wisconsin. So it's our plan to keep them open and provide them with the resources they need to do so.
I think to that point, the social distancing strategies are, again, this is a place where those are options in childcare, and we are encouraging and did encourage, DCF did through their guidance to think about those social distancing strategies for children in these centers. But it is really important to be, I think, concrete about who needs childcare. And when we think about the ripple effects, the equilibrium that the governor's talking about, who needs childcare most essentially are our healthcare workers, our folks who work in nursing homes, and people that we need to keep the healthcare system robust and able to handle incoming patients who are suffering from more severe disease. And so the rationale is really a fundamental public health need to have an infrastructure in place whereby this critical workforce can maintain their jobs. And so I think parents who wish not to use childcare should obviously be able to do what they need to with their employers to do what is right for their family, but we have to have an infrastructure that supports essential personnel to keep our healthcare system operational moving forward.
Can you hear me? Can you hear us? Are you able to hear me? Because on NBC News right now, the president just announced a void gathering of more than 10 people. So is the governor going to change his mind on the restaurants?
I would say avoid people, period, but that is not a mandate. Our mandate is around 50, and that's where it will be until such time that we believe that we need to change it. We believe it's reasonable. It's a reasonable approach, but I think the president's message isn't much different than ours, frankly. And he is indicating that social distancing is really important, and whether it's 10 or 50, that's his recommendation. But as far as a requirement, we think 50 is a reasonable place to be.
Okay, thank you.
Thank you. And with that, we're going to wrap.
One more question, Lee.
I have one. I would like to ask a question.
Very quickly, please. Who is this?
Charlie from the Crawford County Independent. Ohio's governor is asking to move the election scheduled for tomorrow, the primary, to June. That's his recommendation. And you should see what the president is saying on TV. It's changing. That's all I have to say.
Thank you very much.
Thank you.
I would like to have another question too.
Any follow-up questions can be sent to dhsmedia@dhs.wisconsin.
And like, they still got you guys on the answer
Call us on our media line. So wait.
Hello? Hello?
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.